on the couch with us right now. We have Dr. Brad Batchelor here, and he is going to talk to us a little bit about Batchelor Chiropractic. So thank you so much for being here with us.
Nice to be here.
Yeah, so can you kind of tell us a little bit about your chiropractor office and what you guys do, how long you've been there?
Well, would you like to know what chiropractic is?
Yes, that would be wonderful too.
Let's start with that.
So this morning, about 10 minutes ago, I was still with patients. I asked some of my patients this morning, I says, what would you like to hear on a TV show about chiropractic? So they said they would just like to know what chiropractic is if they didn't know. So basically, chiropractic is the analysis of the body to determine how well the nervous system functions. So since the brain controls everything in the body, right? How does it tell the organs what to do? Do you know?
I don't.
No, that's a great question.
So if you cut the nerves to your heart, would it function properly?
No.
If you cut the nerves to the top valve in your stomach that keeps the acid from going up in your throat, would that valve operate properly?
No.
So we have the brain, then the nervous system goes through your spine, 24 movable bones, and some of those vertebrae can misalign or not move properly, and that can affect the function of the nervous system. So if the nervous system does not function properly, that part of the body may not function. It may be your leg or your hip or your lower back or your neck, or maybe it's a nerve that controls an artery to some part of your body or an organ. So chiropractic basically is not just for back problems. It's for, like a lot of people think, chiropractic is reducing nerve interference in the body. So the healthier your nervous system is, the healthier you're going to be. So chiropractors reduce nerve interference or help the nervous system function better.
Okay.
Did that answer your question?
Yeah, it does.
Definitely.
Yeah, so what kind of things do you see when your patients come into you? What is a certain...
Well, recently, since it's winter now, there's a lot of falls on the ice. And last week I saw 3 compression fractures that a couple had to refer for MRI and to other people, like orthopedic or neurosurgeons, to take care of that. Or I've taken care, like this morning I took care of a guy that was doing a flip 10 feet in the air, snowboarding, and fractured a vertebrae in his lower back. So it's kind of complicated, and I can't tell you really what we would do to that, but that's the acute situation. I take care of a lot of car accident people because I testify in court. I've done that for a long time as an expert witness because I'm kind of like a biomechanical engineer. So when I deal with the patient's spine, we obtain mathematical formulas from x-rays and many other, we do neurological and orthopedic tests and many different types of examinations to determine what part of the bodies are not working efficiently, and then try to design a program to correct that situation, or improve it at least.
Right, and I'm sure it's probably a lot of relief for your patients as well.
Usually.
Yeah, what we're hoping for, right?
that's the whole goal. I mean, I'm really in chiropractic because I want to help people's health, or take care or maintain their health, and then treat the problems that moved away from the optimum angle of health.
So, well, have you always seen yourself being a chiropractor or chiropractor?
Chiropractor, doctor of chiropractic.
Yeah.
Well, when I was a little kid, I used to take care of the people on the playground. Like, if somebody got hurt, I was the guy that helped them. I didn't know what a doctor was of any kind, but it was just ingrained in my brain, I guess. And then through high school, I worked for a veterinarian for like 3 years, and I thought about possibly being a dentist or a veterinarian, because I just always had this inborn situation where I wanted to fix, human ailments, right?
Right.
Or animals even, So it's not like my job is a doctor of chiropractic, or I have to be a doctor of chiropractic. It's what I do. It's just what I do. It's like eating.
Right.
So that's what I've done for a long time.
It's your passion.
Right.
Yeah.
Neat. Now talk with us a little bit about the process of becoming a chiropractor. A lot of schooling, I would imagine.
Right. Well, you need 4 years of pre-chiropractic or pre-medicine, and then 4 years of chiropractic school after that. And then you take many different exams to get a state license.
Okay.
So you can go to school, but if you can't pass the license, then they don't let you play,
I understand. And I would say those tests are pretty hard. What do you think?
Yeah, pretty hard. I
Yeah.
mean, that's, you know, I used to live in an apartment with about 1,000 3x5 cards with terms that you'd have to memorize. You know,
Oh
it's
my
like, so
goodness.
it's just like any kind of medical school or dentistry or osteopathic school.
Right.
Neat. Now, what can you tell us for someone who's never been to the chiropractor before? What is it going to be like when they get there? What are kind of the steps you're going to take to figure out what's wrong?
A typical patient will come in our office, and we have electronic medical records, so there's not very much paperwork, but we do have a kind of a comprehensive history dealing with why they're there. They may be there because they want to stay healthy, so it doesn't take a lot of paperwork or computer work, or they may have an acute problem. So my staff, my highly trained staff, will help them complete all the information that they need. Then I'll review that information. Then I'll do a consultation with the person, okay? And then if I accept them as a patient, which I don't accept everybody, just the people that I think that I can help or want to be helped, then we'll do an examination, orthopedic, neurological, you know, I've got a, you know, digital x-ray. And like I said, I'm kind of like a biomechanical engineer. So the x-rays are very, very precise. And we take mathematical measurements of deviations from normal or normal to determine what mechanically is not working efficiently that could affect the nervous system. If they come in for foot problems, which I take care of a lot of foot, knee, ankle, hip, lower back, shoulder, then we'll scan their feet with a computerized analysis, okay? And then determine if they need care in that area. And then after the examination, x-rays, if it's not a complicated situation, I'll treat them that day. If it's not, then I'll review all of their data and x-rays. And then the next day they come in, then I'll give them a report of findings as to what's going on, how long it takes, or do they just want to come occasionally, or to see what their goals are in life. And then if there's, let's say there's deviations from normal in the neck, where they lost the cervical curve, or there's vertebrae that are unstable, then I have a very, very sophisticated instrumentation called a pulse star, okay? And what it is a piezoelectric transducer, okay? Remember that.
Okay.
And it's a very, very sensitive sensor. And this technology is derived from like the aerospace industry, okay? So what this instrument does is connected to a computer, and that taps, a very light tap along the spine, and the rebound force off of that vertebrae, that data goes into the computer, okay? That little force generates current in that instrument. That data goes in the computer, and the computer calculates which vertebrae are moving correctly and which ones aren't, okay? And how bad it is, and it's all graphed. Then the computer, or that instrument, becomes a treating instrument. So the computer will calculate the force, the pounds per square inch, the angle of drive, and the pulses per second, and it will be applied to the vertebrae that are graphed to be abnormal, not just every vertebrae, you know. And it will tap that vertebrae with that corrective force until the vertebrae starts moving better. And the computer senses that information and will automatically stop the tapping, okay? And then it has comparative graphs. So that's a way that, you know, in the old days, people, you know, chiropractors have a bad name because they were wrench and snap, crackle, and pop people. Well, sometimes we have to manually manipulate vertebrae very carefully. But with the new technology, it's kind of like heart surgery or any other kind of medical advancement. It's not like it was in 1910. You know, in the medical profession, in the early 1900s, they were still using leeches, okay? So chiropractic was a little crude then, too. But now it's come along, you know, so it's pretty amazing. Then we have exercise programs that we design from, like if the spinal x-rays are abnormal, to rehabilitate the abnormal mechanical motion of the spine to make the nerves work better.
Okay. So you've seen this come quite a long way since you got into the industry.
Yeah, 1910. Right?
Back in 1910.
Yeah, right.
Now, is this painful at all?
No.
Okay.
That's always
I mean,
a
if
plus.
someone is in a lot of pain, if they have torticollis or something like that. But, you know, the reason I became a chiropractor is I used to want to be a professional water skier when I was a kid, so that's what I did, right? And I had a lot of injuries. So my neck was not in very good shape. But during childhood, I was immortal, you know? So I worked for an engineering company when I was in pre-chiropractic, or not pre-chiropractic, I didn't know what I wanted to do. But when I was going to college, I was working for an engineering company and hurt my neck. And I thought, hey, my uncle went to chiropractor. I was in pain for 3 weeks. So I went to this guy, he was out mowing his lawn. And I said, Dr. Cadell, could you fix something like this, you know? So he told me about chiropractic. He x-rayed me, and I didn't understand what he was showing me. So I tried to show everybody what's happening. And he fixed my neck after a couple weeks, right? But because he told me about chiropractic, I thought, I think that I'd like to try that out, you know? So I applied, they accepted me. And about 6 months after I went into chiropractic school, I realized I hadn't had a headache. And I'd had headaches since I was a little kid, severe migraine headaches where I'd have to go to sleep and get sick and take medication, and nothing ever helped. So 6 months into chiropractic school, I realized I hadn't had a headache. That was like 30 years ago. And I still haven't had a headache.
Wow.
So does chiropractic help headaches? I think so.
Yes.
Yes,
Nice.
Fantastic. Well, what are kind of some tips or cues that might encourage you to go to the chiropractor, or kind of give you an idea that you might need to
If
stop
you
by?
have a spine and nervous system, you probably could benefit, because things that you think are okay right now are not okay. You know, if you have tingling in your hand, it could be a nerve that's pinched in your neck, shoulder, forearm, or wrist, okay? So why let that go, okay?
Right.
If you have headaches, nobody knows why. You just take medication, and people just ignore the situation, you should go to a chiropractor. If you want your nervous system to work better, you should go to a chiropractor. If you want to live a long time, eat right, exercise, you know, take care of yourself, rest, sleep properly, and go see a chiropractor once in a while.
There
You
you
know,
go.
it can't hurt
Yeah.
Exactly.
at all.
Now, tell us where your office is located and what your hours are.
It's on 105 Extension, 483 105 Extension. My hours are 24 hours a day almost, but but our office is open 8 till 5:30 or 6, Monday, Tuesday, Wednesday, and Thursday morning we're open. And then Friday, if I have a lot of acute cases where disc problems, things like that, I'll see people Friday morning. If I'm there Friday morning, anybody can come in while I'm there.
Okay.
I don't ever turn anybody away. I'm not ever going to retire. And, you know, we're just here to help.
Absolutely.
Wonderful.
Yeah.
Well, it sounds like you have a real passion for this and really care about your patients.
That's what I do.
Wonderful.
great.
Well, thank you so much for coming in to talk with us today.
Thank you. It's been a pleasure.
Absolutely. And we'll be back right after these messages with more of the Mountain Television Network.